Hello student, today we are studying drugs acting on respiratory system. Under this we cover drugs used in bronchial asthma, nasal decongestant, drug used in treatment of cough. First, drug used in bronchial asthma. What is bronchial asthma? Bronchial asthma, periodic spasm of bronchial smooth muscles which increases secretions and edema of bronchial mucosa. Because of spasm, large volume of air remain locked in the alveoli, and this leads to dyspnea. Dyspnea means shortness of breath. Next, classification of drugs. Drug used for the treatment of bronchial asthma is classified at first bronchodilator. Under bronchodilator, first is symptomatics. Symptomatics, methylxanthines and anticholinergics. For symptomatics is adrenaline, ephedrine, isoprenylene, oxypyranilene, salbutamol. B. Methylxanthine, example theophylline. Anticholinergics, atropine, ipratropium bromide. Second, mast cell stabilizer, ketotifen, disodium chromoglycate. Third, corticosteroid, beclomethasone, dipropionate. First drug is adrenaline. Adrenaline is a potent drug which act on the beta receptor of the bronchial smooth muscles. It relieves acute attacks and relieves pulmonary congestions. But prolonged use of adrenaline in bronchial asthma may produce resistance and also produce side effects like ventricular tachycardia and ventricular fibrillation. Next drug is ephedrine. It acts on both alpha and beta adrenergic receptor and it is weaker bronchodilator. Next is isoprenylene. It acts on beta receptor of bronchi. Oxyprenylene. It acts on the beta receptor. It has long duration of action and produce less cardiac stimulation. Next, salbutamol. It acts on beta receptor but cardiac stimulation effect is less. So it can be used safely in patients with cardiac disease. Next, theophylline. It is weak bronchodilator. It is effective when adrenaline fails to relieve an acute attack. Patient is resistant to adrenaline. It also produces direct relaxant effect on bronchial smooth muscles. Next, ketotifen. It acts by inhibiting airway inflammation induced by platelet activating factor, and it also has an antihistamic effect. Side effect of ketotifen is drowsiness and dry mouth. Last drug is beclomethasone. It is corticosteroid which is effective in chronic asthma. It is administered as an aerosol. It has topical action in bronchial asthma. So it does not produce any systemic effect. Next class we can cover nasal decongestant drugs.